you can avoid getting the virus and then spreading it to others. One of the best ways to prevent wildfires from spreading is to clear brush around our properties and prevent fires from jumping from one bush to another. We must fight this virus the same way and prevent it from jumping from one person to another. We need to starve it of its fuel that it uses and keep it from burning through our region. So let's all use the power of social distancing and let's knock out this virus. Now, I'd like to introduce Supervisor Fletcher to give us some updates.
Thank you, sir. The slides you just saw really demonstrate a lot of things that we highlighted yesterday, and we will continue to highlight every single day about the vital role of flattening the curve. It is really important to continue to reiterate to the public that we are on the very front end of this situation, and now is not a period to be lulled into any sense of complacency. It is a period to know that these are the critical days where the actions that we take are the ones that will have the greatest impact. If we do what we should do, the greatest positive impact, and if we don't, the greatest negative impact on the potential of exponential growth as this spreads. And so we continue to ask the public to adhere to the stay-at-home orders, to the social, physical distancing orders, and to the steps we're taking. But the whole point of flattening the curve is to ensure that the healthcare system capacity is available for those individuals who need to be hospitalized as a result of that. And a second key component of our strategy and our effort is not just flattening the curve, but it is raising the bar of our healthcare system capacity. As we can provide more access to healthcare services with more rooms and more ICU beds and potentially more ventilators, as we can make these more readily available, it helps put us in a stronger position to mitigate our way through this crisis. And so today we have our Chief Medical Officer, Dr. Nikki Fintidis, along with the CEO, Dr. Patrick Frias of Rady, to talk about a series of efforts that are being taken to raise the capacity of our healthcare system in a hope that can intersect with the need as we simultaneously flatten the curve. Some of these actions are taken by the county. We've been working with UCSD on taking an empty dorm and converting it into an alternate home care setting. This could be for an individual who's currently in a hospital who is not well enough to go home but doesn't need to be in the hospital. As we can potentially open new rooms that transfers folks out of a hospital, that is a room that could be available to someone else. There are efforts like we've talked about before with the expected arrival of a mobile field hospital. This is the equipment needed to actually bring online new hospital beds and how we might do that, again, in close consultation with our healthcare systems. But our medical community and partners have been very engaged and very involved and very creative as we make an effort to take every possible step we can to have more healthcare system capacity available for our public. Before we get to them, we will do a quick update today. As we do every day, we did a series of sector calls. And these calls are important because every single day we're engaging with different members of the community, with different industries, different entities, different sectors to make sure that they're getting all of the appropriate information they need. They have a venue to ask questions, to request support and help. Today alone, we did a call with our binational partners, our military and veterans community, one with college students, one with emergency managers and public safety, one with elected officials and government representatives, one this afternoon with clinics and federally qualified health centers, and Dr. Infantidis will do his clinical town hall. And this is just a snapshot into the daily action and efforts that take place driven by our Emergency Operations Center and everyone here to ensure that all of our entities and jurisdictions are coordinated, and those will obviously continue. Quickly, we will walk you through the now daily slides that we're going to provide to really document and chart the progress, and then our medical experts will be here to provide context to them as well as answering any questions. If we go to the first chart, these is simply the tracking of the cases reported in San Diego County. Yesterday's update, we reported 49 new positives, which brings us to a total of 297. We will continue to update this graph and chart daily. The second chart that we have available is the testing capacity. And again, I want to make sure we reiterate what we said yesterday, This is not essentially every test that's been performed in San Diego County. This is every test that has been reported to us. And we believe that all of our partners are getting into a better rhythm and system of testing. But total number of reported tests in San Diego County, 3,968, obviously with 297 of those positive. The next slide is an update on personal protective equipment that we have distributed through our Medical Operations Center. You will see here that to date, since we began the response to this crisis, we have distributed 423,805 N95 respirator masks, 109,550 surgical masks, 535 face shields, 964 goggles, 4,960 gowns, 3,600 gloves, for a total of more than 500,000 individual items of personal protective equipment that we have distributed. We will continue to fight to get more with requests to the state, to the feds, along with our efforts to purchase available supplies that are out there. And we will continue to fulfill every request as best we can based on the need, the availability, and the burn rate. And our Medical Operations Center continues to work very hard to try and do that. Another issue which we've talked about a lot is the motel rooms that are available. If we go to the next slide, these rooms are designed to serve two purposes. The public health rooms, which you see represented on the side of the chart there, 1,810. These rooms are available to any individual who is a positive test, is a person under investigation, or is an individual with symptoms awaiting further evaluation who do not have the ability or capacity to self-isolate. As we expect the numbers to continue to increase, the need for these rooms will become much greater. And so we moved early to secure them, not only secure them, but secure meal contracts, transportation, security, janitorial, laundry, along with the capacity for daily wellness checks. But out of these public health rooms, 85 of them are presently occupied. And again, as we expect a significant increase in the number of cases, we expect a significant increase in the need for these rooms. If an individual tests positive and they live in a one-bedroom apartment with 4 other people they cannot isolate, these rooms would be appropriate to help slow the spread and the contagion, or obviously any individual who is unsheltered and has no home to go to. Out of the 85 rooms that are occupied, 73 of those are occupied by unsheltered individuals who have been referred to us via our public health nurses, either through our homeless outreach teams or through the shelters. We have given 216 of these rooms to the Regional Task Force on Homeless. 154 of those are occupied. These are rooms for individuals who are homeless who have no symptoms, but they are vulnerable. They are vulnerable because of their age or their underlying health condition. These are individuals who would be most negatively impacted, and we want to make sure that they are in an isolation in a non-congregate care setting. We are going to allocate 221 additional rooms to the Regional Task Force on Homeless that will be reflected in tomorrow's chart, and we continue to work collaboratively with them to make sure that we get them the rooms that they believe that they can fill. The next chart represents some of our outreach efforts. To date, since the second week of March, 211 has received 53,397 calls. Out of these calls, 1,266 have been referred to our nurse triage line. This is the nurse staffing that exists on 211, and we will continue to track and monitor that. We've installed 257 hand washing stations. We have more that have been requested, and we are in the process today and tomorrow fulfilling those requests. On the county's website, coronavirus-sd.com, you can actually see a map that will show you the location of all of the hand washing stations that we have distributed to jurisdictions throughout San Diego County. Our homeless outreach teams, which are out daily engaging with unsheltered, have distributed 1,785 hygiene kits. We are assembling more and will continue to distribute those. And we are in the process of distributing public toilets in areas where we think that there is a need, and we will keep you posted on the progress of each of those. So having concluded the kind of daily rundown, I will now turn it over to our Chief Medical Officer, Dr. Nick Infantidis.
Thank you so much, Supervisor Fletcher. Folks, I need to pause in the context of us talking about all of these efforts and all of these numbers to remind you all that there is a human element to this, and it is unfortunate that I would like to now announce that later this afternoon, when we report our official numbers, we will be reporting the third confirmed death related to the COVID crisis. And it is obviously with deep remorse and regret that we extend our condolences to that family and that individual's loved ones. It is clear in the context of what is going on that we now have what I would call substantial transmission occurring here in our county. Our Emergency Operations Center is activated at the highest level. All 18 individual municipalities have now proclaimed a local emergency, and most, if not all, have activated their emergency operations centers. Following the routine of Dr. Wooten, I'd like to now quickly go through some numbers from the global to the local perspective. Globally, the novel coronavirus has resulted in 476,134 cases that are known, with nearly 21,000 deaths. Nationwide, here in the United States, there are nearly 76,000 positive cases with 1,100 deaths. In California, we are now at a confirmed 2,675 positive cases with 59 deaths. And as of close of our routine yesterday at 5 p.m. for our San Diego region, as was mentioned by Supervisor Fletcher, we have 297 positive cases, with the additional death bringing it to a total of 3 that we are now reporting. As of the last official tally of the 297 cases, 79% are between the ages of 20 and 59. 39% of them are female, and 61% are males. 21% of our documented cases have resulted in hospitalization, and 10% of our documented cases have resulted in admission to the intensive care unit. Though there are some tremendous innovations that are on their way, and I think some additional testing capacity that will be coming, I want to reiterate momentarily that not everyone is currently going to receive a test nor need to be tested. Prioritization is still for our vulnerable populations, which includes the older adults, those who have chronic underlying medical conditions, and those who have compromised immune systems. Additionally, those who are in long-term care facilities, healthcare workers, and first responders, especially our pre-hospital personnel. And I just want to make quick mention that for our first responders, we have developed an innovative process to ensure that they are isolated and tested to prevent the spread throughout their fire stations and facilities in which they are residing. Overall, to the community, I want to say that, as I have said before, that I believe we are still, in a sense, if you look at it from the viral storm perspective, we are still in the eye of that storm. And has been mentioned over and over again, and I will tell people the data that I poured over earlier today, our system capacity is still very, very not only strong, but it seems to be enhanced. As we have heard, but bears repeating, this is really a two-step process. It's about lowering the curve with all the things that we have in place. And again, just a reaffirmation of the Live Well San Diego motto with stay home and stay well. But really, for the next few moments, we want to focus on that notion of increasing our capacity. Under the leadership of our EMS medical director, Dr. Christy Koenig, we look at things through the 3S prism. We call it staff, structure, and stuff. And I want to say that as we are monitoring all of those things and enhancing them, we are optimally doing everything that we can. This pending challenge has really led to some unbelievable collaborations. I can say that on a regular basis, leadership of the county is meeting with leadership, the top leadership of all of the hospitals, the medical leadership of all the hospitals, local medical groups, safety net, even all of the chief nursing officers. And there is so many collaborative efforts going on. Today, we wanted to highlight just a sample of those happening at one of our local healthcare institutions. And with that, it is my privilege to introduce my friend and colleague, Dr. Patrick Frias, the CEO of Rady Children's Hospital. Patrick.
Thank you, Dr. Nick, and thank you, Chairman Cox and Supervisor Fletcher. So, as Nick said, my name is Patrick Frias, and I'm President and CEO of Rady Children's Hospital. For 65 years, Rady Children's has upheld our covenant with the community to care for every child who comes our way. And I can assure you that during this time of crisis, we are more committed than ever to caring for San Diego families and caring for every child that comes our way. I'm proud to lead an amazing workforce of nearly 5,000 clinicians and non-clinicians who have literally dedicated their careers to care for children. And today, I'm even prouder to be part of this collaborative environment where health system leaders, elected officials, public health officials are coming together on a routine basis, as Dr. Nick mentioned, to really enhance the well-being of our community. As we work together to meet the needs of San Diego, Rady Children's leadership is working with other health system and community leaders to think about how we can work together to enhance our well-being. For example, one of the things that we've done at Rady Children's is we've offered to adult health systems that we will increase our age limit for patients into the mid-20s in order to ensure that adult health systems have capacity to care for the sick elderly patients. We're also working with health system partners and research partners in our internal Rady lab and the Rady Children's Institute for Genomic Medicine to work and figure out protocols to increase testing throughout the community. And I'd like to add a few others. Supervisor Fletcher mentioned the outside of the hospital locations like the dorms and other areas to care. And we've certainly looked at our labor pool and tried to figure out how we can help in that regard in caring for patients there. And we've looked to our 3D lab and asked our three-dimensional printing engineers to figure out how we can help address the problem with PPE in some of those areas that you've heard of, such as face masks or potentially swabs. So with that, I'm very proud of the collaborations that are ongoing throughout our community, and I can assure you that we routinely meet as health system and community leaders to enhance the well-being. So I'd like to turn it back over to Chairman Cox.
Thank you, Dr. Frias. We'll now go to the call-ins. I believe we have 2 calls waiting. If you are not identified on in the introduction, please make sure we know who you are and what outlet you're representing.
NBC 7, please state your name and question.
Hello, this is Artie Ojeda from NBC 7. Dr. Nick, can you give us any more information, age, sex, any other information you can on this third death? And then I have a question about testing.
Good afternoon. As is probably typically the case, every time that nature of a question is asked, I personally do not have that information available. I do not believe that information will be released later this afternoon, but any further details or questions about that could be directed to my colleagues in public health, but honestly, at this moment, I have none of those details available.
All right, thank you. It's just the other 2 have been elderly, people in their 70s. I just wanted to know if that was consistent with the third death. Also, with regards to testing, and I apologize, Supervisor Fletcher, I cannot see the charts that you put up, so I don't know what kind of information was there. But I just was wondering if you could give me an update on the number of the ratio between positive and negative test results and what the trend is currently showing.
I will answer that question and say, in my mind's eye, as I mentioned, we have approximately 4,000, close to 4,000 tests overall that have been done. And as was mentioned, the 297 cases are the numerator, and that's the denominator. But there's a big qualifier, and Supervisor Fletcher alluded to this, and I will reconfirm it. It is part of our directives for the labs here in San Diego County, whether they be health system or commercial, to report all results, not just the positive ones. There are some mechanisms and interfaces and details that are further being worked out. I do not believe, I know for a fact that that numerator is probably not 100% inclusive, so I would take that data in context. Thank you.
Okay, I believe we have one other call-in question. If there are other call-in questions that come up, you can still call that line, but after this call, we're going to go ahead and go to the texted questions that have come in. So go ahead.
Union Tribune, please state your name and question.
Hi, everybody. It's Gary Warth of the Union Tribune. Supervisor Fletcher, I was hoping you could elaborate a little on, you said about the mobile field hospital. I was wondering when that was coming, and today we heard for the first time that might be public toilets coming. That would maybe be downtown. Do you know yet how many there would be? But also I wanted to ask Dr. Nick about any new clusters that you know of, any new developments like at the VA administration. There was a lot of people that were being observed. Heard something about a San Diego counseling center, and also something about a Rancho Santa Fe assisted living center. The employees might have tested positive. And finally, I don't mean to go on, but any update on the Covenant Living at Mount Miguel? 2 weeks ago, there was one employee tested positive. Is everything all clear there yet?
So Gary, I'll address the first two, and then we'll kick to Dr. Nick to address the cluster question, the cluster of clustering questions that you asked. As it relates to the mobile field hospital, we announced a number of days ago that the state had told us that we would be receiving supplies. The essence of that is it's the components needed. When Dr. Nick talked about the stuff, it is the stuff of one of the 3 S's that you need. With standing up the potential for a 250-room hospital-type facility. Of course, you still need the structure and you still need the staff. And so our medical personnel, our medical operations center is waiting to receive that, evaluate what's in it, ascertain which components we have, and then they are also working to find the most appropriate structure and staff to potentially increase our capacity. And so we will continue to work through that, and as we get updates, we will share it. But there's a lot of folks working very hard because that is the type of action that can raise that top red line on the chart we talked about yesterday. As it relates to the public restrooms, we are in the process of identifying locations and the process of beginning to get those out. And as we place them and site them, as we did with hand washing stations, we will keep you apprised both of the number and of the location. And we will get more information on that as we move forward.
All right, thank you.
Gary, thank you. I'm going to actually answer somebody else's question and then come back to yours. I just got word that the individual who passed away was an 87-year-old female. And so I am able to publicly share that. Gary, with regard to the questions that you had about the different facilities and so forth, and please know, quote unquote, in the spirit of full transparency, I am not aware of any new clusters. I have not heard any personal updates. Again, if there are specific, deeper questions, we can refer them to Dr. McDonald, but I truly am not able to provide any further updates on that.
Okay, I believe we have one more phone-in call. We'll take that, and then we'll go to the texted questions.
Hi, caller, please.
This is David Gottfriedson from Channel 8 News here in San Diego. On the modeling chart that you released yesterday, there were 2 scenarios. both scenarios reaching 7,000 hospital beds taken up. The first scenario A by April, the second scenario B by May. If my understanding is correct, the premise was that 20% of people get hospitalized. So with a little simple math, it looks like by May, at the latest, there would be 35,000 cases in San Diego, and with a 1% death rate, 350 people dead by May in San Diego County. So with the understanding that this is really preliminary data based on limited testing, is my math correct? That?
Okay, let me ask Supervisor Fletcher to come up, or Dr. Nick. Okay, Dr. Nick will answer that question.
We are a team of one, so if you have anything to add, sir. Let me respond to that because I think everybody is duly concerned about those models and those projections and so forth. We are truly doing everything that we can to be data-driven and data-informed so that we can optimize what we've talked about, the health and well-being of our region, as well as protecting our region's capacity. A thing I want to just gently say is that equation, that modeling equation, had assumptions built into it and numbers built into it that you have heard Dr. Wooten, Dr. McDonald, and myself say multiple times, tip of the iceberg. There is some value for us to be able to plug in numbers and project them out, but I would not overinterpret the exact dates and the math that you said, sir, because I still think, despite our efforts to do that modeling and to be informed by those projections, it is still very early in the process for us to make any weighty decisions. And I'll see if Supervisor Fletcher has anything to add.
Yeah, thank you. Just based on what Dr. McDonald said, and he did allude to the fact that they are working on some more San Diego-specific modeling that we hope in the near future to be able to share. But based on the chart that was provided yesterday, that math estimate is consistent. But the real purpose of that chart was to drive home the point that we need the public to really help us adhere so that we get on a better trajectory. As we get on a better trajectory, even that green line can get lower. As we take actions to increase the capacity of our health care system, that line gets higher. The other thing to keep in mind is that if we do what we need to do in slowing the spread, an individual who needs a hospital bed might use that bed and be discharged, making that same bed available for someone else who comes behind them. And so we will continue modeling, we will continue to share, but it was to really reiterate to the public that although there's some speculation that around April 12th everything may be back to normal, in San Diego we are on the front end of this. And so we really have to recommit ourselves to getting to that green and perhaps even doing better than that while we try to raise that. And so while those estimates were presented yesterday, we will continue to model based on the data and information we have and continue to share that as soon as we believe it's appropriate. Thanks.
Just one quick follow-up question, if I could. I know this model is based on very limited testing. And the county continues to say that people with mild and moderate symptoms do not need to be tested. But if those people were tested, wouldn't the model be more accurate and the estimates be more accurate the more tests that are done?
Okay, Dr. Nick is going to answer that question.
Thank you, sir. You sound like a wise epidemiologist. What you said is absolutely true. The reason that those tests are not occurring is because we don't have the stuff in order to be able to do those tests. There is the national limitation in terms of the supplies and the reagents and the things that we have talked about. But under the scenario and potentially in the not too distant future, as testing capacity increases, absolutely, then the numbers, both the numerator and the denominator, are more accurate, and the modeling means a lot more. Thank you.
Thank you.
Okay, we're going to go to the text questions. I believe the first one is going to be directed to Supervisor Fletcher.
Thank you, Chairman Cox. It's Gina Yarborough from San Diego County News. What action will you take with individuals who use this COVID-19 pandemic to scam residents?
Yeah, for all of the instances of the great things we see people doing and coming together, and we see the goodness in humanity, and we've shared some of those stories, the reality is that's not always the case. And our district attorney has been very aggressive in launching a price gouging and fraud hotline. And we encourage anyone who feels like there is scams, fraudulent activities, or price gouging going on to contact the Office of District Attorney Summer Stephan. The hotline number is 619-531-3507, 619-531-3507. And our message to individuals out there is if you choose to try and exploit the vulnerability of individuals in a time of crisis, there will be a very swift penalty that will come at the hands of our district attorney and our law enforcement agencies. Now is the time we need our community caring for one another and looking out for one another, not seeking to exploit one another. And we encourage the public, as you observe instances that you think where something doesn't seem right, please contact our district attorney.
We have another question. This is from Michael Hart with the Julian News. Could you address what lodging establishments can and cannot be doing? Our understanding is that lodging establishments are open for essential personnel, but should not be advertising to the general public to come visit them at this time.
Yeah, under the executive order and guidance that's been put out, lodging establishments that are a part of the COVID response effort and network are okay to operate. Those are essential in our response to that. Outside of that, they are not essential and should not be operated.
Okay, I believe the next question is going to be directed to Dr. Nick.
Yes, this one is from Will Huntsberry from the Voice of San Diego. Can you tell us how many healthcare workers as well as EMS staff have tested positive for COVID-19? And are there any additional suspected cases amongst healthcare staff?
Thank you. That's a great question, and I will respond by saying that we at the county level do not report our results by occupational categories. That does not preclude individual entities, whether they be health systems, cities, fire departments, districts, of on their own reporting those results. So in terms of a conglomerate accurate number, I would not be able to give that to you. And as you have heard, for example, with testing, first responders and all healthcare workers and frontline health servants are the number one priority category with the others I listed for testing. It is also quickly important to be reminded at the community-wide level that there are times that individuals in the course of their lives can get infected completely independent of the nature of their service. And there is some evidence from other parts of the world and so forth. We don't have enough of that volume yet here locally, but there is some evidence that some of that happens not necessarily in the healthcare delivery or first responder environment. Thank you very much.
Okay, I have a couple of questions from Marilee Moore from Fox 5 News. Can you speak to the need for volunteers for the Medical Reserve Corps? Who is eligible to help and how do they sign up?
Yeah, I'd actually like to invite up Rob Sills, my colleague from the Emergency Operations Center, because there is a lot of things going on with regard to volunteers and potential donations. And Rob, if you don't mind covering kind of that broad category, I would appreciate it.
Yes, thank you very much. We are actively seeking volunteers, both clinical and non-clinical, in our response effort. And the web address was given out before, but it's healthcarevolunteers.ca.gov. And there's a form there. Fill out the form, we'll contact you, and we'll get you through the process. Thank you.
Okay, can we get the next
Yes,
next
also
question?
from Marilee Moore, this is, what can you tell us about the cruise ship that was scheduled to arrive at 3 p.m. today? What is the condition of the passengers and the crew?
Okay, Dr. Nick.
Folks, in the role that I serve as the Chief Medical Officer of the county, have not heard anything from my colleagues that there is anything of concern with regard to that cruise ship. And again, forgive me, I'm doing this a couple times today. I would defer to Eric McDonald, Dr. McDonald, in our Public Health Services. But there are no issues that have been elevated or that I am aware of.
Okay, thank you.
I believe we have only one text question left, and Supervisor Fletcher is going to answer that question.
Yes, this one is from Paul Sisson with the Union Tribune. Has anyone yet been fined for violating social distancing orders?
No one in the Sheriff's Department. The Sheriff has confirmed he has not issued any fines for violating social distancing requirements for the county and the jurisdiction T patrols. You'd have to check with each individual jurisdiction, but there's none that I'm aware of.
Okay, this is going to conclude today's media briefing, but before we conclude, I want to remind, and this was something that was just brought up a couple of minutes ago, active and retired military professionals, that they can help in this fight by enrolling in the Medical Reserve Corps. And again, this is a volunteer corps that is activated during a state or national emergency or disaster. And to sign up, you go to the Disaster Healthcare Volunteer site at healthcarevolunteers.ca.gov. Lastly, we've been talking about ways, big and small, that San Diegans can help during this crisis. And I want to give you one more great example of how everybody is coming together during this crisis. We've talked at length about the need for personal protective gear for nurses and doctors. We had a problem, certainly, with the N95 masks that were in short supply. Seems that there was about 300,000 N95 masks that were in our inventory that became available to us that were defective because the elastic in them had deteriorated. And so what we've seen is 75 volunteers come together and with new elastic basically sew that into those N95 masks so they can be put to productive use. Now, the cost of these masks would be about $250,000. And yet, for the cost of a lunch over the next couple of days, we've got 75 volunteers that are working to make these masks usable for our medical professionals and healthcare providers. Once again, there's an old adage that says a stitch in time saves nine. Well, this is certainly a stitch in time that is going to save lives. And once again, we thank the volunteerism of the citizens of San Diego, all the unsung heroes that are doing things that are being acknowledged and many things that aren't being acknowledged, for realizing that this is a crisis situation. And it's very proud for me to see the way that San Diegans have come together to respond to this. Remember, San Diego, live well, and stay home. That concludes our media briefing for today. We'll be back here at 2:30 tomorrow afternoon. Thank you.